All right. Now that I have my stick, we can begin class. So I feel like you can't fall asleep. Why didn't you do jogging 24? Everybody else. All right, let's see what you guys have learned. Let's see who's sending a message first. Play our missing student.
Oh, Friday. Savannah. Oh.
I got time to read that. All right. Case study. Very, very bad. Don't want that in your throat. You're dispatched to the scene of a 4-year-old with trouble breathing. Mom says he was playing with a Super Bowl before he collapsed. And it wasn't on Super Bowl Sunday. Who do we check with first? Hat. Initial assessment, airway is obstructed. Well, obviously, if it was obstructed, he wouldn't be breathing at 12 breaths a minute, so it's partially obstructed. But obstructed to the point that he's not breathing adequately. 12 breaths a minute on a child is not adequate. And he can't make any sound, and he's got no chest rise. Heart rate's 100, which is very, very bad, and it's dropping rapidly. It means he's becoming quickly hypoxic, and he's unresponsive. What do we need to do immediately? Nobody knows? There you go. Clear the airway. How do we clear an obstructed airway? High pressure. You need to get enough pressure in the thoracic cavity to shoot it out like a champagne cork. Is this child critically ill? That was an easy question. All right. Do not do what that guy is doing. Straight up and down chest compressions. We do not do abdominal thrusts. Any questions? So you do chest compressions, not abdominal thrusts, and it dislodges a Super Bowl. Then you begin bagging him with the BVM until he becomes active and alert again. Any questions? Yes.
So doing CPR on them, even though like he has the pulse, isn't going to hurt him.
I mean, rare. I mean, even commotocordis isn't really, if you're just pressing, it's not like the punk. The commotocordis is hard to do on purpose anyway.
Okay.
What you're trying to do is, it doesn't matter if you can't give that hard rapid compression at the sternum to get the air pressure to knock that out. It doesn't matter anyway for the diaphragm and the airway obstruction.
Okay.
So even if it was bad form, it'd be the least bad answer.
Okay.
Any questions? All right, conclusion. Advanced life support doesn't save children's lives. Basic life support does. That's a great example of it. Any questions? This is a classic picture of Matt Mello, Shafts of Fire. Idiots. Right. Look at it. Huh? No, it's Matt Mello. Call him up and ask him. It's not that. So it's just like, you would not believe how to do. I've gotten to call him and ask him about the picture. It does look exactly like it. All right, so we're gonna go over the traumatic things that kill kids. Remember, there are major physiological differences between adults and children. Children have giant, big heads. Charlie Brown. Everybody thinks Peanuts is a cartoon. Well, it is a cartoon, but it is drawn anatomically correct. Giant heads of little bodies. Any questions? Soft airways, anterior airways, soft compliant chests. Oh, look at, there it is again. Any questions on the differences between adult, child anatomy and the clinical correlation of problems associated with it? No questions. Got restless leg syndrome there? Restless leg syndrome? I think so. Is Friday sitting on the floor? Yeah.
That's here.
Yeah, no, you just got a chair. Where were you sitting in before?
Oh, grab my back.
You were sitting on your back there?
That's what I'm saying. We go from really trip one day and then like so.
No, his name's Fred.
It's fair. I'm very proud. Very proud. Another 50 points.
We don't know what's going on. You just dad.
All right. More anatomical differences in the clinical correlation to them of problems that you have with children that you don't have with adults. While it's in my head, remember, you have all day class Saturday and all day class Sunday. One of the students in this class scheduled an EMT ride along on the ambulance for Sunday. I canceled it because you're supposed to be in class. If you're confused on what days we have class, it's in your syllabus, which is also online that you can look at anytime. 24 hours a day, 7 days a week. Any questions? All right, let's read the next one. A 3-year-old child was found lying after falling from a 3rd-story window. That's a very serious mechanism injury. Any questions? Who do we bring with us? Huh? All right, so it appears that he's got a head injury. He's tachypnic. What is that? What does tachypnic mean? It's a big word. What? Breathing rapidly, yes. May or may not be. Okay, he's got pale skin. So all 3 the sides of the triangle are positive. Does that mean that he's critically ill, impending death? So airways clear, respirations are 40. Heart rate's 190 and his capillary refill time is 4 seconds. It's not good. What do we do? Spinal precautions, high flow tube, be prepared to ventilate, and diesel. Any questions? Any questions? The answer is, to that question, patients in decompensated shock. I think the question's in white, to the white background.
Oh,
Red pupils larger than the left, what would that be an indication of? Intracranial pressure. Any other questions? Thoughts, additions? So ICP as opposed to PP. What is PP? Don't be mature. Pure pressure. Opposed to intracranial pressure. Any questions? So what do? We do a field burr hole in the head. Relieve the pressure. But they might be be like a. So we're doing traumatic brain injury, an abdominal injury, it's got a long bone fracture. You're gonna open the airway, your spinal mobilization suction is needed, system BVM, and get him to the trauma facility. Any questions?
so you're not gonna immobilize the injured extremity?
In or out?
Okay,
I would not do it at scene. Where's the closest pediatric trauma center to we? Where? No,
the other way, is it in Oregon?
no,
No.
Ron Davis?
Davis. Yeah.
Oh.
I didn't hear.
She said that
You're all
first.
talking at the same time. I couldn't hear you. You gotta give voice projection. So in the city of Davis? In the city of Davis? Yeah, no, it's in Sacramento. The college is in Davis, but the level 1 trauma center, the pediatric trauma center is in downtown Sacramento.
All I know is it's UC, that's all I got.
Stockton Boulevard, close to 34th Street.
That's what I'm.
Take the 34th Street exit. Off 50. All right, any questions? That's what blood fuels look like. So increasingly, what are the 3 H bombs of TBI?
Hyperventilation and hypoxia.
Wow.
Oh,
Yeah.
Well, we said.
Yeah.
just kidding.
I'll take it, yeah.
Hopefully UTech paid attention because he's not going home until he answers a question because he didn't be checked before. Hold on 1 second.
What were they one more time? Okay.
Think that should be. Class, I think, chapter 18.
I coach my mom like all day. I said, well, really, we shouldn't put that. Emojis too? Oh, yeah. It's good for
We're probably gonna do
All right, I'm back. So. Do not hyperventilate the child. That is very old. They found out, so they used to say hyperventilation because if you hyperventilate, that's why it's one of the H bombs. Is it will cause vasoconstriction from the extra oxidation, which will decrease the intracranial pressure, which you might think is a good thing, but then at the same time, they found out they actually do worse because you're doing it by restricting blood flow to an already injured brain. So the brain dies faster. So you decrease the pressure and kill more brain cells. So probably not a great idea. Any questions? All right. Ready for another one? We got an older one this time. 14-year-old that sustained a single gunshot wound to the chest. Entrance wound in the left anterior, just below the nipple line, and you can't find an exit wound. Who do we bring with us? Airways opened. He's breathing 40 breaths a minute for a 14-year-old. That's pretty high. Heart rate's 160. Capillary refill time is 4 seconds. Blood pressure is 50 systolic, and his eyes only open to pain. He's got no air movement on the left side of his chest. What are you guys thinking? Yeah. Tension pneumo. All 3 sides of the triangle positive. Yeah. So what are we gonna do? You're prepared to ventilate, inclusive dressing. Rapid transport, find someone, you ALS intercept or get them somewhere that they can decompress the chest. Any questions?
What shock position one more time?
Yeah, don't go, we don't do shock position, that's why we don't
Okay.
talk about it.
Okay.
Shock position was supine with the legs elevated,
Okay.
which again, back in the day, back in the old times, they thought it was a good idea because it increased the blood pressure and gave better perfusion to the patient. But if someone's bleeding out and you increase their blood pressure, what happens? They bleed out faster.
So like
So when they
there,
started studying it, the mortality rate was higher.
on this quiz for today, there's one that says to elevate the female's legs when she's having vaginal bleeding.
Yeah, phone back with me out, the guy can do it.
Okay.
Hold on 1 second. Study that slide. See what's needed.
Have you? Do you have like patient contact?
That's okay.
I have not.
Nine?
That's all right.
Just in one?
I'm gonna,
They didn't mean to call.
I just need to like take my little.
So there's a few questions that are found on the practice file. That's all you.
Then I have a 12-hour.
Elevate your legs.
The fourth one.
Depending on what it's for. So like, if they're not bleeding out,
Definitely.
then the shock position's okay.
How about you?
Like if they're septic or something like that, then it's okay to do shock position and over. But if it's a traumatic injury, we don't do shock position anymore because they just bleed out faster.
I feel like this one said traumatic. But okay.
Well, that'd be wrong.
Okay.
Wrong, wrong, wrong. Any questions? Remember to communicate with the family of the injured child. It's going to be very traumatic for them, just like it is for you. Any questions? Use Pat. Pat's going to be your best friend on these. Any questions? All right, burns. What is the big consideration with burns on children versus adult? They have a greater
Surface third.
reduce the mass ratio. Cool. Somebody listen. So due to a greater surface mass ratio, Yeah, everyone's just trying to get a hold of me tonight. Guess we're gonna have to cancel class.
Can't stop.
Next time you joke like that, we're all walking out the building. Can't just sell that.
I know, but y'all lose the hours. So anyway, so this graded surface mass ratio means you're going to have more problems with the birds that are on the same body surface area that you would not have within a swamp. And of course, infection is also going to cause a big problem with potential sepsis. And we're going to go over the flags of child abuse. That's not a very fun part of this class, but we'll go through all that. And burns is one of the flags for child abuse. Any questions? Unfortunately, submersion injury is very common in children. Second most common cause of unintentional death outside of trauma. Consider C spine if no one knows how they got into the water, but of course ABCs are everything. Airway, breathing, circulation. Any questions? Yes.
Are you saying that all burn situations are considered as trauma abuse?
No,
Okay.
I'm saying it's one of the flags, which we're gonna go over here in a bit. Matter of fact, we're gonna go over it right now. I don't know how you did that, but it was impressive. All right, so child abuse refers to any improper or excessive action that harms a child. Now, the thing is, you gotta remember is, as an EMT, you will be what's called a mandated reporter. Which means if you discover a flag, you are mandated to report that flag to the law enforcement agency with investigative jurisdiction for wherever it occurred. You are not making an accusation of child abuse. You are not investigating child abuse, and you're certainly not determining child abuse. You are just reporting the flag. The more flags that you have, the greater the chance that there is probably child abuse happening. Any questions? There's about 2 million cases reported annually. They figure about 25% of cases are reported, 75% never even get reported. Any questions? So again, you are not the one making the accusation. You're just reporting the flag. It is up to the investigative authority to investigate it and either make an accusation or not. All right, lots of signs of child abuse. Let's go over. First flag. Is the injury typical for the child's developmental stage? For instance, you show up and you've got a 10-month-old with their jagged split across their head from their forehead to their temple. And we try to determine the mechanism of the injury. The parents say, oh, she was chasing her 3-year-old brother across the room and crashed into the heart of the fireplace. Do 10-month-olds chase people across the room? Absolutely not. Or if you have a 3-week-old with obvious head trauma that's not breathing, and dad says he wiggled out of my arm while I was driving groceries, do 3-month-olds or 3-week-olds have the muscle motor ability to wiggle? No, they don't. So those would be injuries reported that are not typical for the child's developmental stage. Next one. Is the reported method of injury consistent with the injuries? So I'll give you another example. You've got a 4-year-old with a clean incision to the head, actively bleeding, right? Big time bleeding. And the parents say he fell outside on lava rock. Would lava rock cause a clean incision? And when you advise that, they say, oh, his sister stabbed him with a fork. Would a fork make a clean incision? No. That is not consistent with the method of reported injuries. Let's say that a baby's got a damaged, injured palate, bleeding from the top of their palate. And the parents say the baby was aggressively feeding through a bottle with a rubber tip nipple. Did that cause damage to a palate? No. Those are Reported methods of injury that are not consistent with the injuries. Next one. Is the caregiver behaving appropriately? Most people that are a caregiver to a child are very concerned about the child's well-being. They would call immediately. So let's say there's a domestic violence incident and a 12-year-old boy gets punched so hard by a boyfriend he's knocked unconscious. A typical parent would call 911. But if they took their boyfriend and drove them in town because they're on probation, they can't be around law enforcement, and then drive back and then activate 911, is that appropriate behavior? No, that's child abuse. And of course, is there evidence of drinking or drugs? That's usually very closely associated with any form of child abuse. Any questions so far? About a quarter of the way through the flags. Delay seeking care for a child, again, that's goes through method of reporting. Most people, when their child is injured, they seek help immediately. If there is a delay seeking help, that is a flag. What is the relationship with the child and the caregiver? If you walk into the room as an EMS provider, the child immediately goes to you for protection from their caregiver, that is a flag. One of the biggest ones, the ones you'll see the most common is there multiple stages of healing, i.e. different colored bruises all up and down the body, which shows a pattern of abuse. Granted, some children, especially boys, do have patterns of injuries because they roughhouse and do all kinds of wild stuff. So again, that goes back to age and lifestyle, but it should be not like the picture that you saw when we first started, where it's all over their body and in different stages of healing. And of course, any unusual marks or bruises that also are not consistent with how the injuries were reported to have happened. Any questions?
So with children, you said that they can run up to you and like try to like put you between themselves and if they're, how do you proceed at that point? So I'm sure that the caregiver would not be like, oh
You
yeah.
talk to the caregiver and you provide care for the child. You don't say, oh, this is a flag, you abuse your kid. You gotta go, okay, what's going on? You do your assessment and you make a mental note of it and then you report that. And we're gonna go over how to handle this here in a little bit once we get through the flags. Again, several types of injuries. Burns, especially burns on the hands and feet, or glove distribution. Like they dipped them in hot water, which is a form of punishment. And of course, anytime kids generally are not unresponsive, if there's any decreased level of consciousness and no explanation for it. Any questions? Is the child clean and of appropriate weight? Kids should not have rectal or vaginal bleeding ever. And what is the environment? The environment clean? Is there food? Is the temperature appropriate? What does the environment look like? You have to kick beer bottles out of the way to get to the child. Any questions? So you are required to report any flags, even if there's only one. Again, you are not making the accusation. You are not proving that it occurred. That is up to the investigative agency. Any questions? Sexual abuse, unfortunately, is common. Try to limit examination and also try to discourage children from washing, urinating, or defecating if at all possible. Any questions? That's glove distribution. So we're going to go over risk factors for kids. And so we're going to go over some case scenarios. So we're going to go over some examples here. Called to the home of a 2-year-old child whose parents say she's been crying since falling off a chair 1 hour ago. and the parents insist that you transport immediately, but no one is holding or comforting the child. Is that a flag? Yeah, that's unusual behavior of a caregiver. There's a flag. Do 2-year-olds fall off chairs and get hurt? Absolutely. So that's, but generally parents try to console them and do something. Oh, look at that. We got Pat. Pat says work and breathing is normal, skin circulation is normal, but they appear to be crying and scared. And their parents are not consoling them. So actually, it's 2 flags. It's interaction with the child. All right, so oh, look at that. Different stages of healing. Airways open and clear, respiration 28, heart rate's 100, calorie full test 2 seconds, not bad. They're alert, so they're not critically ill, but when you expose the patient, you find multiple bruises, different stages of healing in different parts of the body. That's not good. So now we've got 3 flags. More flags you have, the more likely there is child abuse. So 3 flags. There they are. Yeah, you know what that's from? That's a belt. So there's 4 categories of child maltreatment. There's physical abuse, emotional abuse, sexual abuse, and neglect. And child abuse spans across all socioeconomics and all races. There is no socioeconomic or race that is immune to child abuse. Any questions? There's some more glove distribution. Donut shaped burn that's usually put the kid in boiling water or very hot water. Believe it or not, yes, there are people that bite children. All right, so let's go over some. Let's go over some child abuse mimics that are not actually child abuse but do look like it. So Mongolian spots, which is the center one there, that's just spots that are on a kid. It's not an actual bruise. Cupping, which actually is not abuse. It's a Far East medical procedure where they take a cup and they heat it and they put it on there and supposedly sucks the toxins out of the skin. I almost said spirits. And then the last one is coining, where they rub the coin up and down. Same thing, it's supposed to get the toxins out of the skin through vasoconstriction and vasodilation. There is, I guess, some evidence that it actually works. So who's at risk to be having child abuse? Kids under the age of 5, any environment of drug and alcohol abuse, a history of domestic violence. Any questions? So what do you do? Communicate, don't be judgmental, don't confront the parents. You're just going to report it, protect the child. And those are the 4 things you do anytime you have a flag. Suspect, recognize the flag and acknowledge the flag. Protect, treat the patient appropriately and transport them. Respect the family. You do not know if it's child abuse or not. You're just noting the flag and reporting the flag. And collect, document any findings or evidence. Those 4 things will be on tests, and they are key to what you're supposed to do when you have a flag. Any questions?
If, we have one child that's like critically injured or whatever in case, and parents like, no, or the language.
Law enforcement. Yeah, so like it's end of March, early April, kind of like the time of year we're at right now, but it's like this is like the best March we've ever had in my life. But it's generally like 40 degrees outside. And like you have a guy that's dead drunk to the point he can barely walk, and he's got his 3-year-old without a life vest in the canoe on a lake. He tips the canoe over. The child's like hypothermic, but he refuses to let anyone touch or treat the child. Call law enforcement. Not that I would ever have known about a specific situation like that.
Oh, wow.
Any questions? So in this case, a transfer child emergency order mother discloses once confronted by CPS that the father has been abusing the child. Any questions? They handle it. Ready for the next one? No? Well, we're gonna go forward anyway. All right, call to apartment where you find an 11-year-old caring for a 13-year-old boy with a fever. What's your first flag? You're not supposed to be babysitting till you're 12. So neglect. Babysitter leads you through a dirty room littered with beer cans to a child lying face up in a crib whimpering. She says the mom did not leave any bottles for the baby. Got a flag? Yeah, environments. Now we have 2 flags. And it's unsanitary conditions. So fortunately for you guys, you brought Pat with you. Pat says the appearance isn't good. It's got a weak cry and not very active, but got a more normal work of breathing and circulation's normal. So it's a sick kid, but it's not a critically sick. Respirator's 36, heart rate's 120, or pick warm and dry, blood pressure's good, they're alert. But the 13-month-old that only weighs 6 kilograms, which is about 14 pounds. And they got their ribs were protruding. And much smaller, looks much smaller in state of age. So what's that sound? Signs and symptoms of malnourishment. So now we got 4 flags. And you discover a cigarette burn on the child's finger. Now we've got 5 flags. So what do we do? Respect, protect, respect, collect. Know it, learn it, live it. So we're going to make sure the child's taken care of. We're going to transport it and report the flags. You're going to commend the 11-year-old for calling 911 and ensuring the child's safety. The 11-year-old is not the one at fault here. And we're going to document and communicate the findings. Make sure that it is taken to the appropriate investigative authority. There you go. Any questions?
Hello.
All right. Any questions? Again, you are not the one making the accusation. You're just doing the 4 steps when a flag is notified. Any questions on child abuse? You guys went through that really fast. All right. Let's talk about SIDS. SIDS is a terrible situation. The child that destroys toys, puts them on barbecues, lights rockets to them. Got a few Toy Story families. Just kidding. Sid has nothing to do with SIDS. Sid doesn't have an S on the end of his name. You never seen Toy Story, Devin?
All of them. Which one's your favorite?
Neglected as a child.
All right. So SIDS. SIDS, believe it or not, we've made a lot of progress with. When I first started back in the olden days, we used to get 3 or 4 SIDS a year. just in South County. It's pretty rare to even see nowadays. So we've made a lot of progress. It's still poorly understood and there is no definitive answer for why it happens. It's when babies just die. However, you have identified risk factors for babies that have a higher likelihood of having SIDS occur. So a teenage mom, smoke during pregnancy, and child born with a low birth weight. Those three things are generally common in, I believe, 90% of all SIDS cases. Low birth weight. So
Considered baby around 6 ounces.
6 pounds?
Yeah.
Definitely under 6 ounces. Yeah. It's a third of a pound. Now we don't want a quarter pounder, we want a third pounder. Yes,
Why would a mother that's younger than 20?
they don't know. That's what I'm saying. They don't know. What they do know is that when you have these factors, the rate of SIDS is way up. They don't understand or know why SIDS happens. But they do know that these three things are the highest counts of SIDS babies. So they've done a lot of education, and education appears to have really dropped the amount of SIDS cases. So what do? You assess and manage the patient. If it's a resuscitatable by protocol, you start CPR. If they're obviously rigorous, there's postmortem changes, then you don't do CPR. And if you do, then, and no matter what, you be supportive of the family, you don't be judgmental, you follow your protocols and be supportive as possible. Any questions? But yes, there are sometimes when mom and dad wake up and they go to get the baby out of the crib and the baby's rigid. You're not going to do CPR on that. Any questions? So again, environment, family interaction. Where was the baby when it was discovered? Any questions? Ooh. There'll be test questions on this too. ALT. Also known, it could be on the test as BURE. Brewy. Not a brewy. Brief, unresolved, yeah. Brief, unresolved life-threatening event. Brewy. But now they call it ALT, same thing as a brewy. So ALT, same thing, is very, very poorly understood. No one knows why it happens. Well, what we do know is if it's happened once, there's an excellent chance of it happening again. These kids have a high mortality rate. So the typical scenario in this is parents find child unresponsive and not breathing. They pick the child up, blow in its face, or shake the child wakes up, starts screaming, and then they think they overreacted. Problem is then these kids get found dead later. So when you have an ALTE patient, it is very common for the parents to want to AMA. And you have to recognize the situation as an ALTE. And you cannot AMA them until you make base hospital physician contact and full education of the parents who've gone about what ATLTE is and what the potential is down the road. Any questions? No one in their right mind with the education about ALTE would ever refuse treatment. Any questions about ALTE? Brewy, yeah, brief, resolved, unexplained event. It could also be listed as BRUE, but for most tests now it's called ALT. And it's like I said, no one has any idea why, how, or why it happens, but it does happen. And there's an extremely high reoccurrence rate. Any questions? Death of a child. What do we do? So this is for when there's postmortem change and we're not doing CPR. Be supportive. They insist on resuscitation efforts. You do resuscitation efforts even though they're futile. Just do it. Do not speculate ever on the cause of death. That's the medical examiner's job, not yours. And there's an excellent chance you're going to be wrong when you speculate, so don't do that. Preserve evidence if there's any potential for child abuse. Make sure law enforcement's involved. And make sure that you get a CISD, critical stress debriefing for yourself, your team, and make sure that the parents have there should be an avenue for the parents to also get help because these are very traumatic situations. Any questions? Oh, we got a whole chapter we're gonna do on special needs. But there's a lot of kids out there with special needs, and you're seeing a lot of them in the field now. So kids with special needs used to get institutionalized for life, but our society and our payment for that society has changed greatly, and a lot of these kids come home now. It's not uncommon to have kids that are home and trached on ventilators. Matter of fact, there's multiple in this community right now. And things go wrong, and you will be involved on 911s. So it goes kids with chronic lung problems, congenital heart diseases, neurological diseases, chromosomal problems. Then we got a whole chapter we're gonna be going over next week on this. Or we could just do it now. Tracheostomy tubes. These are kids that are generally on vents at night or in the daytime. There's no way to keep an endotracheal tube in that long, the cups will fail. So they do a permanent alternative airway called a tracheostomy. And some of these kids even go to school. I had a case out in Butteville once where a trach kid was out playing with their friends on the field there at Butteville Elementary in Edgewood and tripped and fell. And when she fell, her tracheostomy tube came out and she quit breathing. So they called 911. One of the teachers' aides grabbed it, ran it over the fountain. Are you cheering for a dead child?
No.
Well, you're going. I got it on camera. Oh, so you guys weren't paying attention.
No.
I see how it is. We're just learning about what to do when kids are dead, you know. But anyway. So, carrying on. So she rinses it off in the sink and she put it back in, and the kid started breathing again. By the time I got there, kid was alert. Did fine. Very impressive. Most people would go, I don't know what to do. She at least tried it. She was successful. Doing something is always better than doing nothing.
My grandson worked my other grandson's eating about twice in 2 days.
Yeah. That's not fun.
He's 6 months older than that, a little one.
Yeah, but it's still not fun.
No, and the ambulance showed that it's just chaos.
The medic put it back in?
No,
No, they can't. It's not a scope right, so I'm
the
kidding.
second time, I think my daughter put it back in because the first time at the hospital, they're like, it's gonna happen a lot, here you go.
Cool.
Yeah.
Yeah, I know of a similar situation where the mom was a teenager, but the mom was usually under the influence of alcohol and would actually do a blind drunk and just put it back in.
That's muscle memory right there.
Well, except that
Not
she
great.
didn't do it under sterile conditions and
No.
caused other problems and moving forward. But yeah, if she knows how to do that, it's probably a good idea.
We
'Cause-
spent 7 months in the hospital before they let her go home with them.
Yep.
No.
So artificial ventilators, very common now, especially at nighttime. Some of these kids, they do fine all day long, but at nighttime they require a ventilator. The ventilator malfunctions, what do you do as an EMT? Disconnect it and use the BVM. Be prepared, because sometimes these kids are gonna be alert And you're gonna need to breathe with them. What I do is I put a little bit of pressure on it, like a CPAP. And when I feel them trying to take a breath, then I give the squeeze, help them take a breath. How you do it? Any questions? You gotta be paying attention that you can't be like, oh, got a text message. This kid's going. You gotta actually be paying attention. Any questions? Central line is also common, especially kids that are getting long-term treatments for cancers and other things. They'll put a central line in them so that way they can access it to give medications multiple times a week. So they're not having to start new IVs in a child, like literally every day or every other day. They gotta stay clean, make sure you don't accidentally rip them out, so they're inside of a great pain. Any questions? Definitely an indication the child has a significant medical history if they've got a central line. Feeding tubes. This is when generally, kids that are trach or have other problems, they have to have feeding tubes. As long as there's not, as long as they don't get overfed, kids live with this every single day. But just be prepared for it, and they do get pulled out very easily, and sometimes kids will actually pull their own out.
You did that too.
Playing with it, they get bored, start tugging on the peg tube. Any questions? Shunts. So shunts are very important for you guys to know about. You'll never see one. But you know about them so that you can recognize when something's wrong. Because shunts are used for a condition called hydroencephalitis. That's a big word. So let's break it down. What does hydro mean?
Water.
Water. And what's encephal mean?
Brain.
In the brain. And what's itis mean? Inflammation. So water inflammation on the brain. And remember, kids, when they're little, don't have the calcification of the skull. So if you start getting high water and inflammation of the brain, what's going to happen? It's going to become huge. So, because the fontanelles aren't fused yet. So what they do is they put in a shunt, which is just a drain at the base of the skull, and it runs down the neck, inside, and in the peritoneum. You would never know they have it if somebody doesn't tell you. And then the fluid just gets absorbed by the peritoneum, and that way they don't get the hydroencephalitis from fluid. It's often a result of shaken baby syndrome or other things. Sometimes it's just disease, sometimes it's complication of birth. A lot of things can cause it. There are thousands and thousands of people all the way up to adulthood that have shunts and live every day with them and don't have a problem. When you're going to run into a problem, what you're going to see in EMS is when the shunts fail. How does a shunt fail? They get an infection, they get a meningitis or something goes wrong. You get a little bit of pus, and the pus includes the shunt. And then you start getting intracranial pressure from the hydroencephalitis. So what are you going to see? You're going to see signs and symptoms of intracranial pressure, Cushing's triad, severe headaches. So be prepared. If they have a shunt, there should be red lights and sirens going off in your head if they have no signs and symptoms. Any questions? That's an important one to know because there's a lot of shunts out there. All right. Yeah. The end. But wait, did we make it through over 100 slides already in an hour?
We're not even supposed to watch that till next week, so it's not far away.
What?
We're not supposed to see that till next week, you said.
I know.
It's not far away.
234 slides was the answer, Ms. Leach.
Thank you.
Nobody else was counting, but you were. All right, so let's see. So tonight we were supposed to do environmental.
We're at least almost a week.
ahead. So why don't we take a break? Come back at 7:15. Group 1 here, group 2 here, group 3 here, group 4 here, and then we'll see who's going to break before skills. Since we're so far ahead, we're going to play Wheel of Fortune.
Jeopardy.
Huh?
It's Jeopardy, isn't it?
No, we're gonna play Wheel of Fortune, played Jeopardy last time.
Oh, you have a whole nother game.
Yeah, we're gonna play Wheel of Fortune
Oh,
this
okay,
time.
I just thought you were calling it the wrong thing.
I'm just
Are
kidding,
we
we're gonna play Jeopardy.
No, I got straight.
I
don't know. It's our new group.
New groups, yeah.
Just play down. I honestly don't know if I have it this time.
You gotta have.
Here's the music.
My brain's not working.
I was able to.
No, nice.
Go.
It's a new group, so we don't have it. Oh, yeah. Early. 7 or 2.